she had really, really poor appetite. So now looking back, we think maybe this has been happening since we were even in primary school, because my dad was a real poor eater. Aches and pains, keep an eye on that. They say fever, but I think fever is probably when you are now unwell and feeling probably just down, then the fever would set in. Ascites is the last bit. Somebody mentioned witchcraft, was it you? In Sierra Leone, when somebody is unwell and their stomach swells up, they either say you are a witch or you've been bewitched. So that's stigma already, and people do not come forth. And that's usually the last stage. Once your stomach is swollen, your limbs are all swollen, all that excess fluid will be difficult to get rid of. That's normally, like I said to most people in Sierra Leone, liver cancer, death sentence. So let's look after our liver and prevent it. How do you get hepatitis? Because now you've heard about the symptoms, you know where the liver is, you know what happens with an infection, but how does it get transmitted? Mainly like 90% is through mother to baby when you're giving birth. Here in the UK, when you have hepatitis and the levels like viral loads are high, just like with HIV, we encourage you to have a cesarean section rather than push the baby. Because when you push the baby, as midwives, I'm a midwife, I know when the head is crowning and baby is not coming, you are so tempted to just do things, cut and get this baby out, and that blood can transfer to the baby. So babies can get it easily from childbirth, especially through a vaginal birth. Through injections that are contaminated, mainly in Africa, because here we do really well. When you inject someone and you use the same needle, pass it on to somebody else, or back then when we were growing up, we didn't do it, but we saw our relatives like queue up, have their gums dyed with a bunch of needles. You have like 5, 10 of them queuing up, and those needles could have transmitted most of these infections innocently. Through invasive procedures, I think we've mentioned tattoos, the gum dyeing, cultural practices like FGM. There's a strong link in parts of Africa with FGM, again with non-sterilized equipment. You'll use one blade or one scissors from one child to the next, to the next, to the next. And you are passing the infection. It's just obvious. We've put sex down last because we don't want the stigma. We heard about a story in Africa that somebody they told had hepatitis, they prescribed the medication. The medication is almost the same as HIV treatment. So you don't want to see your relative, you don't want your relatives to see that medication